Hi, my name is Nicole Theriault. I am Yannick's mother. But I always say he's my son because I don't want to look so old. I want to talk to you, to all the women around the world who will be listening to YouTube, this video. It's about living with breast cancer. I have been diagnosed with breast cancer in May of 2009, and when I went for my mammography, because I'm 57 years old, I was doing mammography every year because of my mother who died from breast cancer. We believe she did. We are not sure because she was in an old home place when she died. But we know that the lump had come back in her breast before she died. So we are not sure if she died of cancer or if she died of probably painkiller or something, because she had a lot of pain. Anyway, my cancer was diagnosed, as I said, in May. When I went for a mammogram, they said on the report here, this is very important for all the women outside, this is why I'm giving you this talk about what to do if in case you need to go through cancer. You need to have all your report. You are as intelligent as anyone else out there, and you can read and understand, and if you don't understand the words that's on this paper, you can always search them on the internet, or the better is to speak with your family doctor or your surgeon or whoever, any doctor you can trust, and ask him to give you all the explanation of all the words you don't understand. This is very important. The worst thing, if you are diagnosed with a breast cancer, if you're scared of having a breast cancer or any other cancer, the best thing to do is to look out for information. What you are scared of, you are scared of the unknown. The unknown is, for every human being, is the scary part. So if you are not in the unknown, then you won't be scared. If you know what's going on, you will not be scared. So on this mammogram, it says the appearance is of that cystic, because I have cystic breast. It says the appearance is highly suspicious for malignant lesions such as carcinoma. So they sent me for an ultrasound to check if this, to confirm if this was exactly what they believe it was. So on the ultrasound, it says that it was suspiciously malignant, a malignant lesion, and they suggest either a needle biopsy or a stereotactic guide with the guidance of the needle. What they do is they just take the needle, they put it inside your breast where the lump is, and then they can take a little part, do a biopsy. It doesn't hurt at all. So do not be scared of that part because it doesn't hurt. Or to have a surgical excisional biopsy for further evaluation. I have seen my surgeon. After I got this report, I went to see the surgeon and I said, I don't want you to play around this and let the cancer spread or whatever if it's cancerous. So I said, the lump that is suspicious, I want it out. I want you to take it out, so this way it won't be there anymore and it won't be dangerous anymore. So I went through a lumpectomy, which is the removal of that little cyst that was about the size of my little finger, 5 millimeter. And the surgeon removed it, sent it for a biopsy, And when the biopsy came back, it said it was cancerous. Now, what is the most important part for you to know when there is a suspicion, when you have cancer, a diagnosis of cancer? You need to know what kind of cancer, the behavior of the cancer. Is it aggressive or is it normal? So, on your report again, you ask for your report. That is very, very important to read everything, because this is your body and you are the only person who has the choice to make your body well. Doctors can help you, but they are not the one who are going to take care of your body. You will have to take care of your body. You will decide. That's one of the things we have on this world, is the freedom of choice. And you can choose the treatment, you can choose to have things done or not done. But you will be scared if you don't know what it's all about. So when they announced, when the doctor gave me the biopsy report, he said it was cancer. Now, the week when I was waiting to have the answer, those weeks I said, what about if I have cancer? How am I going to accept that? And I thought, well, Nicole, you have a choice. You have a choice to cry out loud, cry your heart out if you want, or you can accept the facts. Facts are the facts. If the doctor says, or all the laboratory, you can have a second opinion. I had a second opinion. I said to the doctor, maybe the lab made a mistake. I want to have a second opinion. So they did. The second opinion came back with the same diagnosis. So when I went to the doctor, and he said to me that I had cancer, I thought, is that so? So now what do we do? Because I knew then that if I had a choice, and that is thanks to Oprah TV show and Dr. Hector Tolle, who last year gave a lot of episode about how to react about the ha-ha moment. To me, it was a ha-ha moment because I was so calm receiving that news that I just couldn't believe it. I was thinking, am I in denial here? And because I was accepting, I thank God for giving me this experience in life, because cancer is like any other experience. You can die of cancer, you can die of a heart attack, you can die of a pneumonia, you can die of anything. Why should I be scared of cancer? Cancer is just a word that if you don't change your way of doing, you will probably keep on having more cancer. Like if you have a heart attack, and if you do not change your way of eating and your way of behaving, you will probably get another heart attack. So cancer is about the same thing. But we have more knowledge about the heart disease, than we have about cancer, because there is so many different cancer. So now I needed to know what kind of cancer that I had. On my report, it tells you everything. It tells you that it was a ductal carcinoma, NOS type. That means that it's a grade 1. And it was a nuclear grade 2 out of 3, which is not an aggressive cancer. Now, you need to know what kind of cancer it is. So on the other part of the, it will tell you what kind of receptor, what the cancer is nourishing itself with what. In my case, I was an estrogen receptor. It was weakly positive for progesterone receptor. 8 to 10% sales.